there is another holy.
Hello and welcome. You are watching Tracking COVID-19. I am Anil Thomas. This is our special half-an-hour show in which we tell you all the developments on the pandemic. We also get you inputs about the steps taken by the administration, inputs by our correspondents, global developments and experts' advice. All packed together in the next 30 minutes. Let's begin with the top updates. Prime Minister Narendra Modi interacts with state chief ministers through video conference, urges leaders to formulate plans to improve the lives of ordinary people, emphasizes 2 yards mantra to tackle COVID-19. ICMR advises states to stop using rapid test kits from China, asks states to return all kits, assures countrymen there is no shortage of testing kits. People who are clinically diagnosed to have very mild COVID-19 symptoms or are in the pre-symptomatic phase now to have the option for home isolation. Health Ministry issues guidelines. Health Minister holds video conference with 10 major healthcare institutions including AIIMS across the country, asks them to be prepared for the challenges to come. Hospitals say they have no shortage of any kind. Number of active cases of corona across the country rises to 21,632. 934 people have died due to the virus. 6,868 patients have recovered so far after treatment. Global tally of COVID-19 cases increases to more than 30,41,000 and the death toll crosses 2,11,000 people. And the WHO warns pandemic far from over, raises concern over vaccine shortages, disruption of normal health services world over. Well, those are the top developments. Let's first begin by taking stock of the developments in India in Ground Zero. Well, as per the latest data released by the Ministry of Health and Family Welfare, 21,632 active cases of COVID-19 have been reported across the country. 934 people have lost their lives due to the virus. 6,868 people have been cured or discharged, while one person has migrated. The Health Ministry on Tuesday issued a fresh set of guidelines for people practicing home quarantine with mild symptoms of COVID-19 or those who are pre-symptomatic. According to the fresh guidelines, those who show COVID-19 symptoms but are not severely affected by it now have the option for home isolation. The ministry further said that the new guidelines are an addition to the existing ones. As per the eligibility for home isolation, the person should be clinically assigned as a very mild case or a pre-symptomatic case by the treating medical officer. Patient must have requisite facility for self-isolation at their residence. Also, a caregiver must be available 24/7. And the Arogya Setu app must be downloaded and must remain active at all times through Bluetooth and Wi-Fi. Meanwhile, patients must fill the undertaking before self-isolation as provided by the government. They are also advised patients to seek medical attention of serious symptoms as they develop. A patient to end self-isolation only when the health officer clinically certifies them free from infection. The Health Ministry has also listed the symptoms that determine if a patient needs medical or immediate medical attention. Moreover, they are to end the home isolation only if and when clinically advised by the treating medical officers. Further details, more details are available on the Health Ministry's website. That's www.mohfw.gov.in. Moving on, as India enters the final week of the lockdown, Prime Minister Narendra Modi on Monday convened to the chief ministers that the country will have to give importance to the economy as well as to continue the fight against COVID-19. In a video conference with the chief ministers, Prime Minister Modi also highlighted the importance for states to enforce prescribed guidelines strictly in the coronavirus hotspot zones. The Prime Minister underlined that the lockdown has yielded positive results as the country has managed to save thousands of lives in the past 1.5 months. He said the country has seen 2 lockdowns till now, and now we have to think of a way forward or ahead. He said that as per the experts, the impact of coronavirus will remain visible in the coming months. Reiterating the mantra of Do Gaj Duri, he said that masks and face covers will now become part of our lives in the days ahead. Prime Minister said that we have to give importance to the economy as well as continue the fight against COVID-19. He highlighted the importance for states to enforce guidelines strictly in the hotspot, that is the red zone areas. He further stated that the efforts of the state should be directed towards converting the red zones into orange and thereafter into green zones. The chief ministers praised the leadership of Prime Minister during this period of crisis and also highlighted the efforts undertaken by them in containing the spread of the virus. The leaders also expressed gratitude towards the police force and the medical staff for the exemplary work done by them in the fight against COVID-19. Meanwhile, the Indian Council of Medical Research, or the ICMR, on Monday asked the states and union territories to stop using the rapid antibody COVID-19 testing kits procured from China. Spokesperson in the Health Ministry assured that at the level of ICMR, we have sufficient amount of kits as far as RT-PCR test is concerned. Not only sufficient amount of kits are available, but we also have parallelly ensured geographical adequacy. Union Health Minister Dr. Harshvardhan held a video conferencing with the directors of AIIMS located across the country as well as ZIPMA, Puducherry, and took stock of the preparations in view of COVID-19. The meeting saw the Union Health Minister call upon all these institutions to be keeping themselves ready for the future needs as well as assuring them of all possible necessary help that is needed from the ministry's end.
उनके सामने एक तो वहाँ पर जो कोविड के लिए उन्होंने तैयारियाँ की हैं, बेड्स के मामले में, लेबॉर्ट्री टेस्टिंग के मामले में, पेशेंट्स की केयर के मामले में, और इसके साथ साथ भविष्य में भगवान ना करे तकलीफ़ ज़्यादा हो जाए देश में, तो उस समय के लिए उनकी क्या क्या तैयारियाँ हैं, एक तो उसका सारा रिव्यू किया है। उनको अगर किसी और चीज़ की भारत सरकार की तरफ से आवश्यकता है तो उसके बारे में भी उनसे हमने पता किया है। मान लीजिए उनको और वेंटिलेटर्स चाहिए और उनको कोई पीपीई किट्स वगैरह चाहिए, लेकिन मुझे खुशी है कि सबने मोटे तौर पर ये कहा कि उनके पास सब कुछ पर्याप्त मात्रा में है, लेकिन हमने उन्हें विश्वास दिलाया कि आपको जो कुछ भी चाहिए वो आप लीजिए।
Moving on, Human Resource Development Minister Ramesh Pokhriyal Nishank on Monday interacted with parents across the country through a webinar in view of the circumstances arising out of COVID-19. During the interaction, HRD Minister said that the NCERT has sent books to almost all the states and very soon these books will be available to the students. On questions on conducting the remaining exams of CBSE 10th and 12th standards, the Union Minister said that the examinations in 29 core subjects will be conducted at the very first possible opportunity. He also responded that education of students is continuing through the various online platforms of the ministry and informed that more than 80,000 courses are available on the ministry's Diksha program. He further went on to say that e-learning in the country has witnessed an appreciable upsurge during the past few weeks. The HRD Minister will today interact with the education ministers and education secretaries of all the states through video conferencing to discuss issues like handling COVID-19, midday meal, Samagra Shiksha, etc. to ensure that students continue their studies in these trying times. The government has issued a a list of do's to prevent people from the stigma around the COVID-19 pandemic and stand together in this time of crisis. The instructions include appreciating and being supportive to people providing essential services, sharing only authentic information from government sources, cross-checking information on COVID-19, and sharing positive stories about people who have recovered. Well, after taking stock of what's happening there on ground zero, it's time now to take a look at some updates that inspire hope and positivity in tackling coronavirus outbreak. Well, starting first up with tea farmers, positive news for them. Tea farmers of Kangra district, that's the tea plantation and small-scale tea growers in the country, will not be affected amid the lockdown after being exempted by the government. Also, the production of Kangra tea will not be affected. It is believed that the ban on assessing the tea gardens in the first round of lockdown could affect the tea production. However, exemptions have given the opportunity to workers to prompt production successfully. However, the Palampur's Tea Board of India Deputy Director Dr. Anupam Das said that the tea planters are facing problems as operations are running below 50% capacity due to labor shortage. He added that weather this year has been favorable for production of tea.
जो लास्ट ईयर में हम लोग 9.2 लाख फॉर्मल सेक्टर से प्रोडक्शन लाया, इनफॉर्मल सेक्टर को छोड़ के जो लोग हैंडमेड टी बुटीक टी बनाता है, जैसे गांव में लोग बनाता है, तो वो छोड़ के जो 9.2 लाख जो हम लोग रिकॉर्डेड प्रोडक्शन हिसाब से जो लास्ट ईयर कांगड़ा इंडस्ट्री का ओवरऑल प्रोडक्शन देखा, इस साल भी हम लोग उम्मीद कर सकता है जैसे मौसम का जो सपोर्ट मिल रहा है उसमें वो बरकरार रहने का ही ज़्यादातर चांस है.
After a brief halt due to the coronavirus pandemic, the road construction work in Bihar has resumed. District administration has given the nod for it, following which the Gaya National Highway 82 4-lane road construction has begun. Evidently, measures to contain the spread of coronavirus are being taken. Sanitization and social distancing are being followed strictly amongst the workers. More so, laborers on the site are happy to receive or begin work once again.
का काम चल रहा है वो प्रधानमंत्री के गाइडलाइन के अनुसार चल रहा है. हमारे यहाँ लगभग 120 लेबर काम कर रहे हैं. सारे प्लांट में सभी चालू है. जितने गाइडलाइंस हैं हम लोग पूरा पालन कर रहे हैं और सब जितने स्टाफ हैं सबको सैनिटाइज कर रहे हैं. हम लोग सब अपना डिस्टेंस बना के काम करते हैं.
Well, the coronavirus pandemic has gripped the entire world. Everyone is trying their best to prevent it and stay positive in this time of crisis. In view of this, some artists from Surat's Waracha area in Gujarat have made paintings on the road giving a message about how COVID-19 is spreading in society and how coronavirus can be avoided by following the simple rules of lockdown. As the lockdown continues across the country due to the corona pandemic, the Delhi police is providing food to thousands of people daily, along with fighting the battle of corona. The courageous work of Delhi police is being praised everywhere. The sportsmen, industrialists and people associated with the judiciary are also encouraging them in this courageous work. Additional District Sessions Judge Virendra Bhatt reached the Ross Avenue District Court in Delhi to encourage policemen and distribute food to the poor. During this, Additional District Sessions Judge Virendra Bhatt commended the police and appealed to follow the government guidelines to deal with corona.
ये हमारा फर्ज है, इंसानियत के नाते बहुत फर्ज है हमारा और ये बखूबी अपना दिल्ली पुलिस ये फर्ज निभा रही है. नहायत ही ज़रूरी है, तभी घर से आना, नहीं तो घर में रहो. सोशल डिस्टेंस, जब घर से बाहर आओ तो सोशल डिस्टेंसिंग का ख्याल रखो.
Rising to the occasion, Mumbai Mayor Kishori Pednekar has decided to return to her old calling, nursing, to contribute in the fight against COVID-19. Pednekar was a nurse before coming to politics and has decided to join the team of BMC's BYL Nair Hospital to aid the COVID-19 patients in their fight against the virus. The mayor has tweeted, "Anything from Mumbai, we can't do work from home, we are on the field for you, stay at your home, take care, #COVID-19, at Naya Hospital. The Madhya Pradesh government on Monday banned spitting in public places to contain the further spread of the deadly COVID-19 infection. The state government decided to slap a penalty of 1,000 rupees on those who are found violating the ban by spitting in public places. Urban Development and Housing Department has issued an order in this regard on Monday. The commissioners, chief municipal officers of urban local bodies have been authorized to slap the penalty in their areas of jurisdiction. The state government has already banned the sale of gutka and pan masala till further orders to contain the pandemic. With most of the businesses shut and lives coming to a total standstill, the streets wore a deserted look due to the lockdown announced on March 25th last month to contain the spread of COVID-19 pandemic. The stray animals have to suffer a lot in search for food. And at this challenging time, an NGO based in the Jorhat city of Assam called Puhor, Voice of the Voiceless, has come forward to feed these stray animals and also providing free treatment to these animals. Dunia has this special report.
While most of the people are confined to the safety of their homes, stray animals that found a home on the streets had nowhere to go. They are not getting the leftovers and are suffering due to the lockdown. Hence, several volunteers of Puhor, a non-government organization based in Upper Assam's Jorhat, have come forward to feed dogs facing starvation due to the lockdown.
Puhor is basically an organization which deals with the feeding of the stray animals, especially the canines, and which is our main objective, and also feeding them time to time and vaccinating them and giving them treatment on time. And we are a member of more than 100 people in Puhor.
The stray dogs in Jorhat town need not worry about food and a caring hand anymore, with Puhor providing shelter, rescue and free medical treatment.
सारे रेस्टोरेंट्स वगैरह सब जो खाने वाले जितने भी हैं रास्ते के डस्टबिन्स भी हटा दिए गए हैं और कोई भी कहीं खाना नहीं मिल रहा है तो हमारी रिस्पॉन्सिबिलिटी बनती है बिकॉज हमारा मिशन ही वही है जानवर बोल नहीं सकते उनको तो उनको खाना वगैरह दे रहे हैं तो जितने भी जीव जंतु हैं उनको ट्राई करते हैं कि कहीं फंस गए हैं कहीं मुसीबत में है कहीं कोई बीमार है तो उसको भी हम लोग मेडिसिन वगैरह देके हमारे साथ में NGOs के साथ में हम लोग जोड़ने की कोशिश करते हैं.
Around 150 of these street dogs have been given anti-rabies vaccination at an anti-rabies camp held on the 1st of March this year in Jorhat to ensure safety from this life-threatening disease. Puhor, which is working for animal welfare, was formed on the 1st of January 2020 in Jorhat. It is now planning to reach out to neighboring areas and extend a helping hand to stray animals.
These stray dogs behind me are just having a hearty meal. Thanks to the efforts made by these volunteers of NGO by the name Puhor in the Jorhat city of Assam. They are providing these animals with food, shelter as well as free medical treatment. Such deeper engagements goes a long way to reiterate our faith in humanity in these trying times. With camera person Rishu Singh, this is Dwena reporting for DD News.
Well, in the latest disclosure by the government, a fake news has been busted over the deduction in allowances of employees working under central government. Media reported speculating over deduction has been termed as misleading. The Press Information Bureau, that's the PIB, has clarified that there is no proposal for any deduction in allowance of central government employees. There is also a myth circulating on social media that hand dryers are effective in killing the novel coronavirus. Please note that hand dryers cannot kill the novel COVID-19 virus. The PIB's fact-check team investigated it and revealed its reality. It says hand dryers are not effective in killing the virus. To protect yourself against the COVID-19, you must wash your hands frequently with soap and water or use an alcohol-based sanitizer. Once you clean your hands, you can use a hand dryer or paper towel to dry them. Well, time now to scan through the developments from across the globe in World Wrap. World Health Organization has warned that the new coronavirus pandemic is far from over. Speaking at the regular briefing in Geneva on Monday, WHO Director General said that he was deeply concerned about the impact of the disruption of normal health services, especially on children. Noting that several European nations are preparing to ease coronavirus-related restrictions, the head of WHO urged countries to continue to find, isolate, test and treat all cases. He added that the WHO body was concerned about the increasing trends in Africa, Eastern Europe, Latin America and some Asian countries. The WHO DG also expressed concerns that some of the efforts to stop the spread of COVID-19, such as closing borders, has resulted in the shortages of vaccines against other diseases in 21 countries. WHO Director General has urged worldwide solidarity to stop the spread of COVID-19. He said that if people are not united, the virus will exploit divisions between individuals and continue to create havoc, leading to more loss of life. He said every life is precious, and WHO's top emergency expert Mike Ryan said that the United States seemed to have a science-based federal plan for fighting its coronavirus epidemic.
As lockdowns in Europe ease with declining numbers of new cases, we continue to urge countries to find, isolate, test and treat all cases and trace every contact to ensure these declining trends continue. But the pandemic is far from over.
Well, taking a look at world numbers, 30,41,550 confirmed cases have been reported across the globe, while 2,11,159 people have lost their lives due to the COVID-19 virus globally. Moving now to country-specific, first up, United States of America, where the overall death toll is 56,245, with 9,88,451 confirmed infections reported to date. The total number of people recovered in the United States stands at 1,11,197. However, certain restrictions have been lifted in several states, but shopping malls remain closed. Washington State will reopen some outdoor recreation on May 5th, while Texas will ease certain restrictions and restart businesses soon in phases. Meanwhile, United States President Donald Trump has said that he would consider easing the sweeping travel restrictions he imposed on European countries depending on how the continent responds to COVID-19. Italy, meanwhile, has announced to ease Europe's long-running lockdown to contain the COVID-19 pandemic. Prime Minister Giuseppe Conte said some restrictions will be eased on May 4th, including the reopening of parks, factories and building sites. Our correspondent from Europe, Lucy Hoog, has more on this.
Italy went into full lockdown on the 9th of March, one of the strictest in Europe, in the country that was at the beginning the epicenter of the pandemic. There are now plans about how it intends to emerge. The Prime Minister Giuseppe Conte said on Sunday evening that from the 4th of May, people will be allowed to visit their relatives in small numbers. Parks, factories and building sites will reopen, but schools will be staying closed until September. Bars, restaurants and hairdressers are allowed to reopen from the 1st of June. Over the weekend in Spain, children were allowed to leave their homes to play for the first time in 6 weeks as the government eased restrictions that have kept anyone under the age of 14 from venturing out in public. Its health ministry said earlier that 288 people died in the 24 hours leading up to Sunday, which is the lowest number since the 20th of March. There will be a slow easing of the lockdown from mid-May, but from the 2nd of May, people will be allowed to take exercise outside. In Germany, dozens were arrested in Berlin on Saturday, out protesting against the lockdown. Around 1,000 people turned out, calling for what they called an end to the state of emergency, but there was a tough response from German police. Lucy Hoff, Dordashen News, Brussels.
Well, moving to United Kingdom, that saw the lowest daily rise in coronavirus deaths in hospitals in 4 weeks. Prime Minister Boris Johnson, in his first appearance after recovering from COVID-19, said Britain is beginning to turn the tide in the fight against the virus, but insisted now was not the time to ease the lockdown. Holly Hudson has more on this.
Despite some encouraging signs, the Prime Minister Boris Johnson said he refuses to lift the lockdown restrictions in the UK while there is still a danger of a spike in cases and deaths. He made a brief appearance on the steps of Downing Street on Monday to address the nation, his first day back at work since, of course, recovering from his own case of COVID-19. He joked, apologised for being away from his desk a lot longer than he'd have liked, but his central message was very much a serious one. It's not over yet. He said the UK is winning the battle, the first phase against the virus, but the UK is also at a moment of maximum risk. He urged the public to contain their impatience, saying he understands businesses' concerns. He wants to get the economy moving as soon as possible, but refuses to throw away everyone's sacrifices, he says, until it is safe. He left the daily coronavirus press briefing to the Health Secretary, Matt Hancock, who echoed many of his concerns, many of his warnings, saying it's clear the UK is moving through the peak of the virus, but it hasn't consistently passed it yet, and that is one of the 5 tests the government say needs to be satisfied before they'll consider looking at easing any of the social distancing measures in place here. There were some tentative signs of progress as cases and hospital admissions continue to fall from coronavirus. Some normal health services for cancer treatment, for example, will resume as of Tuesday, and the number of tests carried out a day continues to slowly creep up. 37,000 is the latest figure. Mobile testing units have been rolled out. Drive-through centres increased. The government, Matt Hancock, maintains they're on track to hit 100,000 a day in just 3 days, saying that the country has now surpassed the total number of tests carried out a day by South Korea and is approaching the level of tests carried out a day by Germany. So some encouraging signs, but even with Prime Minister Boris Johnson back at the helm in number 10, the government still resisting those calls, refusing to clarify and spell out its exit strategy. Holly Hudson, London.
Well, staying positive and optimistic during times of crisis can be challenging, but it's critical to your mental well-being and immune system. The coronavirus pandemic has left individuals with the sunniest of outlooks maybe having a hard time staying positive. Remaining optimistic in the face of social distancing and isolation is tough. Use the 4 Ps: perspective, purpose, positive thinking and productivity to combat COVID-19 stress. That's all we have time for, and it's time for me to say goodbye. But do you know of the good things about goodbye is that it means you are a little closer to a new hello. Take care, stay safe and indoors, being positive. Bye-bye.